Okay, I'm here with Dr. Walter Bennett, and we have some great stuff to talk about today. Three advanced medical treatments you should know about for knee, hip, and shoulder pain. A lot of this is going to be arthritis pain. Plus, he's going to talk about what is stem cell therapy and can it possibly help you. I think it's important because uh, I see there's been a lot of medical advancements lately, and medicine advances so fast. It's incredible. But you also see the other side of the coin. For example, my Facebook account, my news feed, it's filled with stuff for stem cell, and they're calling it a miracle cure, and um, that's just not true. And so what we'd like to do is cut out all the miracle cure talk and this and that, and give everybody the down to earth truth about some treatments, if it can help you, if it can't, how you can find out if you can get looked at to see if these treatments can help you or not. The best way to go. So we're here. Dr. Walter Bennett is here, and Dr. Bennett, would you like to introduce yourself and tell us who you are and what you do?
Sure. My name is Walter Bennett. I practice in Fayetteville, Tennessee and Murfreesboro, Tennessee. I've been practicing a little over 15 years now, and my practice is limited to musculoskeletal pain disorders.
Cool. And I met you probably back in 2001 or two, or maybe three. I'm not even sure now. Time really flies. But I met you at a seminar, and we've always kept in touch and Facebook and stuff. And I like to bring the best treatments available to people so that they can help their pain and stuff. And I know that you're doing some great work there. And I also know that you're an honest guy. And that's really, really important today because there's just a lot of stuff out there. Anyway, the first treatment here we're going to talk about is we hear a lot about these things called gel injections, and it's actually viscosupplementation. But anyway, this is a big treatment for knees. I've also seen a lot of advertisements about this with a lot of big claims and stuff. Could you tell us, what is this? How is it done? How does it work? And what kind of patient realistically expect? And are you doing anything differently?
Okay. This is going to be a long answer. All right. Gel injections, as you said, is viscosupplementation, and there's many different brands of them. It's a series of 3 to 5 injections. The injections themselves come from rooster combs. It's basically man-made synovial fluid. So you're going to get 3 to 5 of these injections in the hopes that we can decrease the amount of friction that is in that joint. Because as you know, as we age, we start to lose our synovial fluid, and we start to do a little grinding in there. That grinding leads to inflammation, which leads to more damage, more pain. So the whole point of the gel injections is, the way I explain it to patients, it's like an oil change for your knee. We'll pull out some of the bad stuff, and then we'll put new fluid in. And it works pretty well with somebody with mild arthritis. But if you have bone on bone grinding in there, it's not a cure all. It's not going to fix that.
So this doesn't help every single person arthritis. Would you? So you're saying that if someone is in a earlier stage, this is a better treatment for them?
Oh, it's a much better treatment for them if they're in an early stage than in a later stage. And it's not. Yeah, if you're in a late stage arthritis, this is going to be of limited value for you. And you asked about how mine are different. Mine aren't just straight viscosupplementation injections. Mine are mixed with a peptide called AOD 9604. Peptides are just amino acids grouped together, and they help the body do a variety of different functions. This particular peptide will help regenerate or heal the cartilage. Now, that being said, after you get my injections with the peptide in it, is it going to regenerate the cartilage to what you were when you were 18 years old? Absolutely not. If you have a 55-year-old knee, you still have a 55-year-old knee. We can heal some of the damage in the cartilage, and we can give you some relief with that, but I can't turn back time.
So what you're trying to say here basically is early stages, and there's different medications, gels for lack of a better term to use. There's different ones to use. Also, is there any difference in the actual procedure you do? I've actually read some stuff about these injections, and it said that doctors actually missed the joint. I don't remember the percentage, but it was quite a high percentage when they do it blind. Could you explain what blind means versus what you're doing?
Okay, my injections are done via ultrasound guidance. So I can put an ultrasound on the knee, and I'm going to watch the needle go into the joint. This way we kind of eliminate that missing the joint, or a blind injection is just where there's no imaging at all and you're just sticking it into the joint. You may or may not hit the joint. And even worse than missing the joint is sticking the needle into cartilage and injecting that gel directly into somebody's cartilage into the knee. That's even worse than missing the joint, period.
So if you're getting these injections and they were done to you and it was done without the guidance of ultrasound or fluoroscopy or something to make sure that the needle and the gel went into the joint, there's a good chance that they might have missed the joint. And a lot of people get this treatment and they think the treatment didn't work for them when it was actually how the procedure was done made it so that the treatment couldn't possibly work. Do you ever get patients in that have had this done elsewhere and it didn't work, and then you did it with guidance with ultrasound, and then you actually got the substance into the joint and they got some positive results?
We've had that happen several times. And I'm not sure if it's where they went prior, if they missed the joint, or I'm not sure if it's the peptides that mine have in it that had a positive effect. So, but either way, the answer is yes. I mean, we've had people that said it didn't work, then they come and we do it and we redo it, and then it works the second time.
So it could be a combination of they didn't have the same substance you injected into the knee, or they might have missed the joint, or both.
Correct. So I'm not sure which one or both, but yeah, we've had some results with patients that said they've had those before and they didn't work.
Yeah. Okay. You do an evaluation for people to see if they're a candidate here. Could you talk about that?
Yeah, you bet. We do an evaluation on people because just because you have knee pain doesn't mean you're a good candidate for the gel injections. What I want to do is I want to make sure that we're not putting gel injections when you actually have a torn meniscus. We want to make sure that the solution is going to help fix the problem. So I want to make sure that you're a good candidate for it. And at the beginning, you talked about success rate. The success rate for me is more about patient selection than it is about the procedure itself. Because if you have somebody that has very severe bone-on-bone arthritis and you're doing gel injections on all these people, you're going to have a low success rate because the patient selection is not right. You're not giving the right treatment to the right patient.
Yeah, it's more about choosing the right patient than accepting everyone and just thinking this is going to be a cure-all. So you do an evaluation and you honestly tell everyone, hey, I think this is the right treatment for you, or I don't think this is right for you. the best road for you would be X, Y, or Z, another treatment. And that may be a treatment that, you do, or you refer a lot of people out because you're just trying to get them to the right doctor. You give these evaluations for free, I understand, correct?
Yeah, we do a free consultation to make sure that um, I'm the right doctor for you, and to make sure that the things I offer can help the ailments that you may have. So we just want to make sure it's a good fit all around. And like you said, if I'm not the right doctor for you, I'll find somebody that would be better fit to handle your case.
Yeah, I think part of what being a doctor is the big thing is to try to get people help, and it doesn't mean try to get a patient for you. It means trying to find answers for them, and it's great that you give consultations for free so that they can come in and they can talk to you and they can ask you questions and they can get them answered, and they don't have to give you a lot of money to find out that you're not the right doctor for them.
Correct.
Let's move on to the next one here. It's PRP, and this is a big buzzword too. There's a lot of pro athletes now getting this treatment. There's been some stuff where they flew over to Germany and years ago and stuff, and now it's here. So could you explain what PRP is, what you're doing?
Okay. PRP is platelet-rich plasma. Now, basically, in how you get PRP, you draw the blood peripherally from arm, hand, wherever, and you're going to filter out that blood and get the platelets. And you want to try and get, 5 to 10 times the amount of platelets into a small sample. Then you're going to take that platelet-rich plasma and put it into the joint that's having the ailment. The whole procedure is kind of lengthy. It takes a good 30 to 45 minutes to do a PRP procedure.
It sounds like some complicated stuff, huh? What is this for? And once again, what kind of results can they expect?
PRP is used for a variety of things. I use it for musculoskeletal problems, such as arthritic knees, arthritic shoulders, hips, tendon problems, that sort of thing. Severe muscle strains in athletes, I've used it as well. But you'll even hear stories of dermatologists using it for cosmetic purposes, wrinkles, all kinds of stuff. So you'll hear about PRP just because you see it advertised for one thing. You can't just don't assume, hey, this is a wrinkle thing. It's not just a wrinkle thing. I mean, you can use it orthopedically as well. And we're getting some very good results with knees, shoulders, hips, that kind of thing with it.
And the same kind of thing is arthritic knees and stuff like that, right? Is that the main thing?
Correct. It's PRP is really the next step up from the gel injections. If the knee is kind of too far advanced for the gel injections to be successful, then we'll go to a PRP.
Okay, so basically, your first step is if it's a mild case, the gel can usually deal with that, and then if it's a more severe case or it's an older case and it's going to need some more help, we're talking about PRP, correct? Hello, you still there?
Yeah, you're correct. I mean, if it's a little more severe case, then PRP is going to be the way to go. On the milder cases, the gel injections with the peptide added are usually sufficient.
Okay, awesome. All right, let's move on to the next thing here, and this is the one probably everyone wants to hear about: stem cell therapy. Like I said, I mean, you hear a lot about this. There's also different kinds. There's a lot here, so I'm not going to talk here. I'm going to let you talk. Could you give a brief introduction about what stem cell therapy is, the different kinds, what you're doing, what it helps, what it doesn't help, the realities here as to what this is?
Okay. This is going to be another in-depth answer, but essentially, stem cells are a blank cell. That means you can put them basically anywhere, and they'll become part of that structure. Now, how you get stem cells, there's 3 different ways. The first way is through adipose tissue, essentially a liposuction, and because there's stem cells in the fat. So you essentially get a liposuction, and the stem cells can be harvested from that. The second way, which is the gold standard, is bone marrow. You do a bone marrow tap, and you can get the stem cells from bone marrow. The third is from cord blood. Now physicians can purchase these from blood banks, basically, and you can give stem cells from the cord blood. Now, there's a fourth type, but these are not stem cells. I repeat, these are not stem cells. You'll see placental products, and these are like tissue graft type things, but I've seen people advertise these as stem cell injections, but they are not stem cells. So you have to kind of be careful, make sure you're getting one of the 3 that are stem cells, and not going with something that's not a stem cell, especially if you're wanting stem cell therapy.
So you have stem cells can be taken from fat. So they do a little liposuction, and they take your own fat out. They do a procedure to your own fat, and they separate the stem cells from the fat, and then it's injected back into the joint. The bone marrow, which they actually drill into your bone, usually the hip, correct?
Well, on the PSIS, on the pelvis.
Yeah. Well, I'm trying to hip term more of a so everyone understands it here.
Basically, the pelvis area.
Yeah. Which is a big procedure. That's not it's actually going into your hip there. And the other one is the cord blood. Could you explain a little bit more about that one and what's going on with that?
Okay, and you can use the cord blood. There's advantages. There's advantages to the cord blood in that from a cord blood. What do you mean by cord? When a baby's born, when you cut the cord, the cells in there can be harvested. There's stem cells in the cord.
Okay.
So from the cord blood, they harvest the stem cells out of there, and they're used for a variety of things. And
is this safe?
Yes, it's safe. I mean, and they're under the same where you harvest these things. They're under American blood banking guides. I mean, they're very stringent.
So there's no problems with acceptance, infections, and all.
No, there's no diseases. They're all screened for diseases. Any disease you can think of, they're all screened for it. And the advantage to cord blood is they're going to divide many more times than an adult stem cell will. So they're more proliferative. So, which is a fancy term for they're more active, which that's a positive thing too. Now, you buy them. The way I do them is I'll do 30 million cells. That's the most you can buy. So that's an advantage, but there's also advantages to using the bone marrow. That's because that's your own blood. So I leave it up to the patient which one they want to do. I do either one. I do the bone marrow or I'll do the cord blood. I leave that up to the patient. But each one has an advantage. And during the consultation, we'll go over the advantages and the disadvantages to each one. And I let my patients make their own decisions because ultimately their healthcare is their decision. So I just give them the information and I let the patients make an informed decision.
Have you seen a difference in the results between the bone marrow procedure and the cord blood? And if you had a choice, if you were going to have it done, which one would you have done?
Well, that's hard to answer because when I do my patients, I'm only doing one or the other. I'm not, I haven't done like a cord blood, and then if that didn't work, then I go back and do theirs. I've never done that, so that's hard because you're not doing the same one on each patient, so it's hard to tell which one's better. And if you look at research, there's research saying the bone marrow ones are better. There's research saying the cord ones are better. So the jury's kind of still out on that. But if it was me, it depends on what I was having done, truthfully. And if I was doing a knee type procedure, I think I would do the cord blood if it was me. Okay, just because it's easier and less downtime with it.
Yeah, and that's what I've read quite a bit about this stuff too, and like you said, people don't understand the research isn't definitive in a lot of procedures, and they're figuring this stuff out. And like you said, I've seen some stuff that said that each one of these was superior. I've read some stuff that said the fat was. I read some stuff that said the bone was, and I've read some stuff that said the cord blood was. I think the bottom line here is that you're doing 2 of them, and you're getting positive results with both. Correct?
Correct. And it's kind of funny. I think how, and if you ask doctors which ones are better, the doctors kind of see the world with rose-colored glasses. You know what I'm saying? Yeah. Whatever thing they're doing is in their mind going to be the superior thing. So any doctor you ask, they can give you a different answer because they're seeing the world with rose-colored glasses. So
yeah,
I'm
that's a
yeah.
huge thing. People like to justify what they're doing, and if they're doing a procedure, they're going to find some research to back it up, even though there might be some stuff that says, hey, that's really not true, or there's research that says another procedure is either better or also good. What I like about you is you're taking a look and you're looking at everything and saying, hey man, all 3 of these things really seem to work. I'm doing 2 of them, and I'm getting results with both of them.
Exactly. I'm doing 2 of them, and I give people the plus and minus, and I let them make their own decision. Whichever one they want to do is fine with me.
So what kind of conditions are you using this for, and what type of success are you getting?
Typically, it's knees, shoulders, hips, musculoskeletal type stuff, and we're getting really good results with it. Can we help everybody? Absolutely not. Because like we said before, and it goes back to what we talked about with the gel thing, sometimes the joint is just too far gone, and no matter what you do, it's just too far gone. And if they had done 5 years ago, it would have been beneficial, but now it's just too far gone. And those people we can't help. But I would say probably about 80% of the people that we get positive results with.
Okay, cool. Are there any side effects, or is there anything people should be concerned with here?
As far as like the bone marrow one, anytime you're going to do a bone marrow tap, you're going to have a risk of infection. So, but as far as rejection or anything like that, I've had a couple people say they had like injection point soreness, that kind of thing, but they're just sore for a couple of days. It's nothing. I haven't had any serious reactions from it. And I've heard of a couple people that had allergies to the additive in the cord blood stem cells, but nothing was serious. So just a small allergy. Then after a Benadryl, it was kind of gone type thing.
Yeah. So, this is a real medical procedure, and there is a slight risk there, but it's, as far as I understand it, is incredibly low. And they're minor things.
Yeah.
Is that correct?
There's nothing 100% benign. Any type of procedure you do, there's nothing that's absolutely benign where there's no risk of anything. But the risk in this type of thing is low.
About the ads and stuff that I see about stem cell and curing all kinds of diseases. I've seen it curing MS and everything. What do you have to say about that kind of stuff that's out there?
Um, I'll be honest with you. I've seen those articles. I've seen those things as well. Um, those aren't the type of treatment arenas that I go into. Those aren't the type of patients that I have. So I have no experience with that. So I don't know if it helps or not. I mean, I'm not going to say one way or the other. I don't know. I mean, I'd have to actually look at more research to make an informed decision. But as far as does it help all these list of conditions, I've seen people say it, and I've seen it on ads, but I don't have any experience with it, so I'm not going to say.
More, not so much the conditions themselves, but about the claims that they cure
Oh,
things and that they.
now I get you.
Yeah,
So,
yeah. I mean, it's obvious if anyone understands stem cells that there is a potential to help any condition, because a stem cell, like you said, it's that blank cell, and it can become any cell, and it can help anything potentially. Okay, that doesn't mean doctors today are getting cures for certain things and guaranteeing cures for certain things.
yeah, as far as that, I don't guarantee cures for anything, And for example, Matt, if you came into my office, I have no idea how your body's going to respond. If I did a bone marrow tap on you, took your own stem cells and put them into your knee, do I know for 100% certain that your knee is going to be fixed? No, I have no idea how your body's going to react to that. Um, Now, when I look at history of patients I've seen, it's been really good. But do I know 100% certain that your body is going to 100% fix your knee after we do the stem cells? No. Now, based on my experience, I can say, hey, we have about an 80% chance of it helping you. But do I know for 100% and could I guarantee a cure? Absolutely not. We don't even have a cure for the common cold. How could I guarantee that I'm going to fix your arthritic knee? I can't.
Yeah, and I think the biggest thing here is to be honest about. There's a lot of procedures now. There's a lot of things that are advancing super fast. It's pretty incredible. Even with that, claiming cures and guaranteeing results is not only inaccurate, it's highly unethical. And everything I've read about the stem cells and stuff, and that's really why I wanted to talk to you here, because everything that I've read leads me to believe that there's a huge amount of potential here, and that in the future, um, uh, near future, it's going to be incredible. And I believe a lot of these cures are going to exist. Today, currently, it's a situation where it's being figured out, and a lot of people are being helped. There's a lot of people, I know people that have had knees, shoulders, and hips, and they've had them helped, and they've gotten out of a lot of pain. They're able to walk again and stuff. And when you see these kind of results, and like you said, it's not everybody. I also know some people who had it done who told me it didn't work. I don't know where they had it done. I don't know who did it. I don't know what procedure. That's really irrelevant. Bottom line is, it is helping a lot of people, and the potential here is huge. And it's something I'm personally looking into, because I played sports for years, and I ruined some of my joints, and I'm really heavily looking into this, because and as you know me, I'm not big on just going and having anything done. But I really think there's a lot of potential here, and I think this can change a lot of people's lives.
Absolutely, it can.
Yeah, you have anything to say there, or
Yeah,
you give?
I've seen it. I've seen it firsthand change people's lives. Um, it's a wonderful therapy, but I just want people to get a fair expectation of it. Um, it's not going to cure everybody for everything, but given the right patient selection, and the right treatment, it can be wonderful, and it can change somebody's life. But like we talked about before, the key is having the right patient. Patient selection is still the key, even with stem cell therapy, PRP, or the gel injections. It's all the same thing. Patient selection is still the number one priority.
And once again, it comes down to that. It comes down to your consultation evaluation. So once again, you give a consultation for this free, correct?
Correct.
So you're not really, like we say, you're giving a consultation free for gel injections, for stem cell. That's not what it is. You're giving a patient a consultation free, and you're going to take a look at them, and you're going to determine, hey, I think gel injections are going to be right for you, or I think you should be doing the PRP, or stem cells are right for you. So you're going to take a look at them. So patients don't come into you for a stem cell evaluation. They come into you for a patient evaluation, and you take a look at them and then say, hey, you have a lot of knee pain here. Your arthritis is at this stage. I believe stem cells the way to go for you. Correct?
That's exactly how I do it. I'm going to take a look at, when somebody comes to see me, I take a look at them. I'm evaluating them. It's not a stem cell evaluation because I don't know until I do the evaluation the best fit for them. If somebody has a mildly arthritic knee, I'm not going to put stem cells in it. That's not needed. It's like taking a 12 gauge shotgun and hunting a spider with it. It's not needed.
Yeah, and I think that's where you get into problems. The old saying is, if you're a hammer, everything looks like a nail. And if you're just doing stem cells, or you're just doing the viscosupplementation, and you're doing an evaluation for that, I believe you're probably more likely to find people who you're going to accept for that treatment. Meaning, if you're just doing viscosupplementation and you don't have the option to do anything else, PRP, stem cell, you're much more likely to fit patients into your visco than find the right treatment for them. Correct? I mean, and then also, I know you too, you're going to send people out. If one of these three treatments is not right for you, not right for them, for example, a total knee replacement. Some people need that. You know what I mean? You get to a certain stage and it's needed. Some people get it when stem cells could help them, I believe. And you might want to touch on that there. But you also, I'm sure, get patients where you say, hey, I think the real answer here is a knee replacement, and I don't even do that here, but I think you should go here. Correct? Is that accurate?
Correct. That's exactly what we do. And the key is, once you've had the knee replacement, there's nothing I can do. And, if you don't want to have the knee replacement, then there's other things we're going to look at. But once you have it, you really can't go back. So before you have that done, you want to make sure that that's the best route. So, and if I can't help you, I will definitely send you to have a knee replacement. But I would hate for somebody to automatically just go to that step without looking at some other things. Maybe you were a candidate for stem cell therapy, but we didn't know. And if you want to get technical, we're going to take a look. And if I think there's only about a 10% or 20% chance that the stem cells are going to help you, I'm not going to have you spend that kind of money to do something that has a very low percentage chance of working. I'd rather go ahead and send you out. If it's inevitable anyway that you're going to have it, I'm going to go ahead and send you out. I'm not going to do that to anybody, because I wouldn't want that done to me. So
yeah, I think the biggest thing is looking out for the patient's best interest here. And the funny thing about that is, when you send a patient out and that's the best thing for them, and they go see someone else, those patients refer. Those patients know that you're looking out for them, and that's how you build. And that's how I know you, and I know how you've built a practice, word of mouth, because everyone knows when they come to see you, you're looking out for them, and you're going to do what's best for them. And even if you couldn't help them, you're going to try to find answer for them. And that's why so many people refer to you. It's incredible.
Well, thank you. And that's exactly how my practice was built. I practice in a very small town in Fayetteville, Tennessee. I mean, so it's not like I'm in New York City or anything. So word of mouth is really the main thing for me. So if word got out that I was giving people things that they didn't need,
You're
I wouldn't
finished.
have lasted as long as I have in that little small town.
No,
But
no.
I mean,
Yeah,
that's just the
yeah.
bottom line.
Yeah, there's a difference, and I mean we're kind of getting off the topic here, but I think it's important. There's a difference between practicing where you do and practicing a city because you're from there, you live there for your life and everything, and like you said, you're from um, Illinois originally, but you live there and you're part of the community, and it's a small town thing, and people they really value integrity, ethics, and that's what you give them above anything else, and there's a lot of technology here and medicine and stuff. Bottom line is, people, I believe, are really looking for a doctor who understands them and honest with them. You're competent, of course, and you're using cutting edge technology here. And if anyone doesn't understand that, not every doctor out there offers the things you do. But you're also an ethical guy, and you're really looking out. You're looking out for people, and it's great. Anyway, you give the free consultations, and I think I have your number here that we can call. Here it is.
That's
So they
right.
can call here, 615-745-1850, and you can give him a call. Just mention the webinar. You don't have to, but say, hey, I heard about you, and he'll set everything up. So anything you want to say about evaluation, consultation, closing words?
No, the phone number you have up there, that's the Murfreesboro office. So
Oh, okay. I screwed it up.
yeah, no, that's fine. No, you're right.
Oh, okay. Okay.
Yeah. So if you're interested in the Murfreesboro office, give that one a call. And if you want the Fayetteville office, call 931-251-3009.
Okay. And the website is here. It's kind of a long word, but they can take a look at that. And cool. So they can give you a call, check them out. Knees, hips, shoulders. Anything else you would like to say?
No, I mean, we do neck pain, low back pain, just musculoskeletal pain. That's kind of what I do.
Okay, cool. Yeah, yeah. Because this was about those three treatments, but you also do other things there, of course.
Yeah, we do a
So
lot of other things, but this webinar was just mainly, excuse me, knees, shoulders, hips, that kind of thing.
cool. Awesome talking to you again, and I highly recommend them. And if you have a question, give them a call. Thanks a lot.
Thanks for having me.
Bye bye.